7, which is very known in axial spondyloarthritis, or the interleukin-23 receptor polymorphism, which is a typical genetic factor associated with the development of psoriasis and psoriatic arthritis. The second factor is barrier disruption. Barrier disruption due to psoriasis, for instance, in the skin, but also inflammatory bowel disease in the gut. And the third factor is autoimmunity. I will give you examples now how these factors trigger inflammatory disease. A particularly interesting one is actually the mechanginflammation, which is known in psoriasis, which has been originally described by Heinrich Koebner, who was a dermatologist, and recognizing the Koebner phenomenon, a failure of resolution of inflammation upon mechanical irritation of the skin, so-called Koebner phenomenon, which leads to long-standing inflammation and proliferation of the skin, leading to a psoriatic plaque triggered by mechanics. This Koebner phenomenon is quite interesting as a sign of mechanoinflammation, as it has been, for instance, shown that mechanical irritation of the skin, like a tattoo, which usually spontaneously resolves after a few days, can trigger the onset of a psoriatic plaque. So it's a very nice example how a genetic background, which is obviously associated with psoriasis, is triggering enhanced susceptibility to mechanoinflammation, which does not spontaneously resolve. This concept is also very important for rheumatologists because the psoriatic state, meaning a genetic susceptibility to long-standing inflammation, is not only triggering skin disease, as I have shown you before, but can also trigger mechanoinflammation at mechanosensitive sites in the musculoskeletal system, particularly